My topic is knowledge and practice of self-medication among students of School of Nursing in selected schools in Osun State, and my name is Abioye Abigail Adebisi. Summary: self-medication is a common practice and internationally has been reported as being on rise and can produce a good result and be a convenient practice for patients. By Verman and Pandy, 2010. Self-medication can potentially do well and also harm people. By Sontate, 2011. The factor influencing self-medication remains issues of intense debate in academic discourse. A number of reasons have been adduced for the rise of self-medication among students. Availability of drugs in markets and poor drug regulatory practices contribute to self-medication. That was noted by Father Ray and Tanumon, 2011. Inappropriate self-medication results in wastage of resources, increased resistance of pathogens to drugs, and serious health hazards such as adverse reactions and prolonged hospitalization. Lukovic et al. 2014. Hence, there is a need to assess the knowledge and practice of self-medication among future health professionals. This can represent a serious threat to professionalism and has a potential risk to public trust in the healthcare industry. So what and problem? In Nigeria, high degree of irresponsible self-medication is practiced. That was noted by et al. 2010. It is a common practice among group of health workers, including nursing students. Et al. 2013. Availability of over-the-counter drugs and lack of enforcement of regulations contribute to the prevalence of self-medication in Nigeria. Therefore, this study assesses the knowledge of respondents on the effect of self-medication. 2. Practice of self-medication. 3. Factors influencing self-education. 4. The relationship between knowledge of the effect of self-medication and practice of self-medication. The theory used for this study was theory of reasoned action by Adjasin and Fishbein, 1980. It provides a framework for this study. 1. To predict self-medication, the theory of reasoned action would explore one's attitude, whether positive or negative, and the subjective norms that one perceives from people around him or her. So, intervention targeting attitude, health education, will look quite different from those targeting subjective norm in community awareness. The method used for this study. The study adopted a descriptive cross-sectional survey. Sampling method was a purposive technique in which 200 nursing students were included across 2 schools. Data collection was through a self-structured instrument. Analysis was done using SPSS version 20.0. Descriptive analysis was used to answer research questions using frequency tables and charts. Inferential statistics such as chi-square was used to test hypotheses at the level of significance of 0.5. Results and discussion. This study assessed the knowledge, practice, and factors associated with self-medication among nursing students. The mean age of the respondent was 21.57, 3.08. Majority, 83.5% of the respondents were within ages 20 to 29. Majority were females, and just half of them were in the 200 level. Results showed that majority, that was 91% of the nursing students, had high level of knowledge on the effects of self-medication. This is consistent with Mehta and Sama 2015 in Nepal, in which more than half of the medical students demonstrated good knowledge on self-medication. Results and discussion. Also, about 2/3, that was 64.5%, indulge in high practice of self-medication. This is similar to the findings of Abiyoye et al. 2013, who reported self-medication as a common practice among group of health workers in Nigeria, including nursing students. Factors influencing self-medication as identified in this study were presence of minor ailments, having enough knowledge about such drug, financial constraints, previous experiences, time saving, and unavailability of healthcare services. All these agree with Rout et al. 2014 and Vieira et al. 2010. Results and discussion continue. This study assessed the relationship between respondent knowledge and practice of self-medication among the respondents. The results showed that significant inverse relationship existed between the two variables. That was 2 minus 2.226, differential is equal to 198, and p-value 0.05. Students with low level of knowledge about the effect of self-medication reported high practice of self-medication than did students with high level of knowledge. That was standard of 1.67. It will be safe if the people who self-medicate have sufficient knowledge about the dosage, time of intake, side effects on overdose, because inadequate knowledge can have a precarious effect on the health of people. Conclusion and future steps. Majority of the nursing students were found to have high level of knowledge and also indulge in high practice of self-medication. 2. Knowledge significantly influence practice, as people with low level of knowledge indulge in high practice of self-medication. 3. Knowledge about rational drug usage and strict governmental control is necessary to prevent precarious effects of self-medication. 4. Health education should target individuals and community at large, as the environment significantly influences self-medication. Although self-medication is recommended to improve the self-care orientation, future study is recommended to assess the types of drugs people can use over the counter, availability of controlled drugs over the counter, and access of such drugs by the consumer for self-medication. Thank you.